First of all, fight for marketing to have a seat at the table, because there are many tables that don't offer a seat to marketing. That's also true, right? Right. And today, the consumer of today is all online and on different mediums. If I were to talk about healthcare per se, then there are two kinds of audiences that we have to interact with, right? There is the consumption audience, could be older people who are more on Facebook, who are more on YouTube, right? So people in that age group, say 35 to 45 to 50, in that age group, you try and get them on, if they're professionals, on LinkedIn, if they're otherwise on Instagram, etc., etc.
Hello, ladies and gentlemen. Welcome to yet another episode of The Growth Genius, the podcast where we bring to you growth stories in marketing and business, powered by Infidigit, the SEO specialists. In today's episode, we have a growth genius who started her career from entertainment but then moved on to healthcare and has spent considerable amount of time in the healthcare industry. She is also passionate about cost-based marketing and CSR initiatives. Please join me in welcoming Ms. Jasrita Dhir, who is the Director, Marketing and Communications at Karkinos Healthcare. Thanks, Jasrita, for coming on to the podcast, The Growth Genius. We are truly grateful to you for taking out the time. Thank you so much.
Thank you, Mehul, for inviting me. I've been wanting to be on this podcast. So, thank you for inviting me.
Let's start with this. Wanted to know more about your role at Karkinos Healthcare. So, do tell us about that first.
Sure. So, Mehul, my role at Karkinos Healthcare entails creating a preference for brand Karkinos. To create preference for the brand, we have to first understand what the brand is trying to do. Karkinos, what it is trying to do is democratize the space of cancer care, build access and affordability in tier 3, tier 4 cities so that people do not have to burn a huge hole in their pocket. And second, also are assured of better outcomes. While the human body, nobody can assure an outcome in healthcare, we know that. But we also know for a fact that if cancers get picked up in stage 1 and stage 2, or even in a precancerous stage, then the outcomes are that much more better than stage 3 and stage 4. Whereas the reality is that whether it's Bombay or Bilaspur, cutting across genders, cutting across income groups, cutting across your propensity to pay, all of these parameters, 70% of the cancers come up in stage 3 and stage 4. And that's what we are trying to change. So my role entails creating preference for brand Karkinos, amplifying the message, ensuring that attitudinal and behavioral change comes. And I know that not one campaign would be adequate for that. One has to keep chipping at it, month on and year on. But start somewhere to be able to have people having more positive disposition towards cancer screenings, towards cancer care, and towards being more cancer literate.
Yes, I think that is the need of the hour to actually nip it in the bud, if I may say. That is something which is very much important today across geographies, Jasrita. So thanks for sharing that. And want to understand more about how do you personalize this experience for the end user, because at the end not every case is the same. So how do you ensure that you do that?
Yeah, so I'll take 2 or 3 examples. The first is that we have a digital app called the digital risk assessment app, and in which any individual, you can download the app and take a digital risk assessment. And because it's the digital risk assessment of that individual, the report that you get is not of a person like you, but so it's tailored to everyone, depending on that individual's risk profile, the family history, etc., etc. So I think there's personalization at that level where the digital medium comes at play. But also at a more far-reaching level, we do have our command center and the customer support executives, we call them care mitras. So our command center is fluent in 18 different languages. So if there is a person who's taken a community risk assessment, let's say in Kerala, then the care mitra will talk to that person in Malayalam and tell that person that, listen, in your taluka or in your district or in your village, whatever it
Mhm.
is,
Mhm.
here is the nearest hospital that you can go to. You're high risk, and because you're high risk, you need to go to this facility. So try and get those people into the treatment funnel at whatever stage that they need to get into the treatment funnel, right?
Right.
So that's a second example that I can give you, and so on and so forth. There are many such examples, but that's how we try to personalize it, because each human body is different,
True.
each one's risk profile is different, how they interact with the environment is different, and therefore we try and personalize it as much as possible.
That's amazing. I mean, you can, at every stage, you can, ensure getting people at different levels of the funnel, wherever it can be, because the sooner the better, of course. But I mean, it starts from there, and at every stage, you have those, I would say, like points where you can probably, get these patients to access healthcare, so to say, so that, the treatment starts earlier, right? That's wonderful. Great.
Absolutely.
Coming to the changes that we have seen in marketing, there has been a lot of change. So how do you get to your consumers in today's digital age?
Since the consumer has moved digital, the core marketing fundamental doesn't change, Mehul, right? I mean, you and I have been marketeers for long enough. And as a marketer, you're told that go and show your product or service where the consumer is. So if, taking a US example, if people are at the Super Bowl, then you put out a Super Bowl ad, right? There are brands, cola brands, for which IPL is important. So there are ads which are being made for IPL. Okay, there was one point in time, not now, when in cinema marketing was big. So you
Yeah.
make something tailor for that, right? The point I'm trying to make is that as marketeers, we are trained to follow where the consumer is, right? And today, the consumer of today is all online and on different mediums. If I were to talk about healthcare per se, then there are two kinds of audiences that we have to interact with, right? There is the consumption audience, could be older people who are on more on Facebook, who are more on YouTube, right? We know that post COVID, the amount of YouTube content, whether it is recipes, whether it is old songs that the elderly generation is consuming, is serious, is it's quite serious, the copious amounts of content that they consume on WhatsApp, on Facebook and YouTube. So obviously you have to be there for the consumption audience who are taking decisions for themselves still in a healthy stage. And then there are people like you and I who have, at a life stage where the children are young, but also the parents are aging, right? So people in that age group, say 35 to 45 to 50, in that age group, you try and get them on, if they're professionals, on LinkedIn, if they're otherwise on Instagram, etc., etc. So really, we try and make the brand relevant for them across all these mediums and across all these touch points, right? So again, to take some specific examples, January was the cervical cancer awareness month. So we did have different experts from within our system and experts from outside, doing joint Facebook live sessions, etc., or ask me anything sessions, etc., right? So on and so forth. We try. The consumer has moved there. They've made it easy for us. So wherever the consumer is flocking, we just ensure that we present the brand, but present the brand in a clutter-breaking way so that they're able to, appreciate what the brand has to say, and at the same time, we also be able to take action on what we expect them to take action on.
Wonderful. So very nicely put, very simply put, such a complex question. So thanks for that. And I want to know your views on, what is the future of healthcare marketing?
The good, bad, and the otherwise. Well, yes, the the future of healthcare marketing, if we look at it from purely from a statistics standpoint, the demographic dividend that we keep talking about, India is going to lose that in about a decade and a half. We know that starting 2030, 2035, we are going to be an aging nation, right? And lot of diseases of comorbidities and complexities come along with it, with an aging population, as we are seeing with US, as we are seeing with Japan, with Germany, with traditionally aging populations. So I think, first of all, from if I look at it from only a statistical standpoint, then the future of healthcare marketing is that I don't see it losing relevance anytime soon. If there are going to be more people sick, If people are going to live longer but less healthier lifestyles, because there is a twin factor at play, that the lifestyles have become poorer, but the lifespans have become longer. So people are living longer, but not necessarily healthy lifestyles, thanks to our food choices, the cities that we live in, polluted air, etc., etc. So I think from a standpoint of relevance, healthcare marketing would be relevant and more relevant. So that's point number one that I can speak about. Second point that I can talk about is, as at least in cities or in smaller towns, right, if not so much villages, as people are becoming more and more health aware. And again, there are two factors at play. One is the urban populations who just want to stay healthier for to be able to see their children's milestones, etc., etc. So there is a more of a pull mechanism at play. And the second trend that's happening is that we are seeing that non-communicable diseases are on the rise, right? So people are having more diabetes, even in smaller towns. At one point in time, at least when we started out, maybe a decade and a half ago, it was said that diabetes is the disease of the elite, of the rich, right? It's afflicting rich and poor alike. So as more and more people in smaller towns get afflicted with diabetes, with heart diseases, with strokes, and with cancers, right? There is this fear to say, I don't want to be caught unawares. Okay, so let me be more conversant with it. And therefore, healthcare marketing, with the digital revolution post the geo age, with the spurt in vernacular that is happening, vernacular marketing, video marketing that's happening, everyone is on video. To sab dekh rahe hain video, to everyone is seeing in every town, age whatever alike, right? So therefore, a healthcare marketer's avenues, right, and also market a geographical expansion would happen. But of course, they have to make it more bite-sized, more snack-sized information rather than too long-term, make it simpler, and make it reach out to people in vernacular languages, use the video medium a lot, right? Stuff like that. So I think therefore that's the second thing that I can talk about in healthcare marketing. The third, and that is more for devices, and that's more for pathology, if I would say, as a market. I think the risk is that already these sectors are becoming very, very commoditized, right? So also a thing that healthcare marketers have to figure out in the future is that how to decommoditize it, right? Because today it's already come to a stage where it is said, so many tests in 2499, and then there is a red cross on it, more number of tests and less money, right? It's already being sold like a sari sale, no disrespect, right? So how do you decommoditize it in the future is also a challenge. It's not all hunky-dory. That's the third thing. And fourth, for healthcare marketing, another thing that has not changed, these are obviously changes that has not changed, is a healthcare marketer always has to ensure that it is for profit. I'm talking about those who are in the non-NGO sector, that while it is for profit, but it cannot be profiteering, right? So we cannot just be profiteering of people's misery. And I think this is something that stays as a ground rule across. So those are 3 or 4 things which I think are the future of healthcare marketing.
Thanks. You have covered a lot of space in that. Thank you so much. Coming to the next question, where do you see organic search in the journey of building a brand in the digital space?
Very much. I think this is organic is what drives trust. And trust is synonymous with healthcare as a category. I think for most categories, you first buy the individual, buy into the promise of the individual or the brand, then you buy the products and the services, right? Like they say, whether it's a salesperson or it's whatever, it says, first I need to buy into your promise, your personal credibility, and then I'll buy off you. Okay. So trust is important for any transaction, but more so when people have to trust their life and limb, so to say. Okay, it's not something where you have a redo option. So therefore, if trust is so much more important in this category, then trust, we know, gets built more from the organic route than the non-organic route, because you can get people to paid media somehow doesn't have. It has its utility. I'm not saying it doesn't have its utility. It has its utility. You have to, when reach is of importance, when you want to reach people en masse, then you have to use paid marketing. That's fine. But we cannot expect lead generation to do the job of building trust with the brand. who the brand is, what they do, why you should care with them, that job is done by organic, whether it is through the testimonials route, or it is through very well written blogs which are well indexed in SEO, etc. So the life of and the importance of organic is indispensable when it comes to healthcare. And I only see this growing with more and more content and content marketing coming in, both the short form and the long form.
Great. That's pretty interesting. Thanks, Jasrita, for that. This question I have to ask because this is the buzzword today. So, what is your take
I mean,
on
guess it. AI. Now is the time that AI will make an entry into the podcast. No question, no podcast, no panel discussion is complete without discussion on AI.
True. So, what's your take on AI in marketing?
Lot of benefits to it. I don't know. Wow. We see that it simplifies many tasks, and not every task in marketing is creative. Let's face it, right? Not everything. People tend to look at marketing as a field where only creative marketing is done. AI helps it in those kind of tasks. So when we have to do translations or into different vernacular languages, or putting together a press release, right? By no means am I saying that just get AI to write the draft and then push it off, right? Of course, human intervention is required. But that job for which you would have to labor a lot, some of those things I think AI has made very, very time effective, if I may say. Very, very time effective and very, very cost effective. And those are the efficiencies and the effectiveness that I think we have to sort of acknowledge. So for comms, for PR, for content, etc., the possibilities are boundless.
Wonderful. Thanks. And coming to the next question in AI. So, do you use AI in your marketing activities? And if so, please share a few examples for our audience.
Exactly the things that I just spoke about, So whether it is, we're using that a lot in our translations. We're using that to put together the first draft of a press release, which then obviously goes changes, etc. We're also trying to use that to figure out, what's your traditional A/B testing that we used to do for creatives. Which images are resonating with our audience. Placement of the logo where, which headline or which sub-headline, etc. We are using AI for that as well. So these are some of the areas. But also, I think for us, these are early days. So this is just the tip of the iceberg. And if we were to do this podcast maybe 6 months later or a year later, I'll have many more examples to give.
Wonderful. Thanks. You have already started your journey in AI as we speak. That's wonderful. Jasrita, any specific growth stories that you would like to share from your professional journey?
Yes, I think Mehul, one that I don't tire ever of telling people, because that's really the impact of marketing and the proof of the pudding, especially for us marketeers, except for lead generation, one doesn't get to see so soon, right? So that's a story that I don't tire of telling anyone. I'm happy to sort of recount that story here also. So this is year 2015-16 where, at Fortis, I was at that time with Fortis, and what we were thinking of is that what is a higher purpose that the brand can stand for? The brand cannot just stand for saving and enriching lives. That's the business that we are in. When you're a tertiary healthcare provider in that space, whoever it is, us or our competition, people will come to you to fix their knees, to fix their spines, to fix their hearts. And to do that is the business that you are in. That's the service that you render. That cannot be the higher purpose. So what's the higher purpose that one can stand for? And at the same time, we thought that how about the higher purpose of, at that time, the second largest healthcare brand of the country, private healthcare brand of the country, which also helps the country standing in some way. So therefore, we took on this very lofty outcome of trying to change the organ donation rate of the country. So for those who might be uninitiated with it a little bit, there are health indices that we all see that WHO puts together, where it's the infant mortality rate or the maternal mortality rate or defecation free, etc., etc. In such things, there's also an organ donation rate, which is the deceased or the organs that we harvest from people who have died. So the deceased organ donation rate of the country is simply that what's the population of the country. The measure, the unit for it is per million population. And we looked at some of the countries like Brazil and Spain, who were the table toppers and I'm talking about 2015. Their numbers were they had 35 donors per million population. They had 40 donors per million population. And for us as a country in India, we realized that for a country of 1 billion, we didn't even have one per million population, one donor per million population, billion people. The organ donation rate at that point in time was 0.45 as we speak. Let's do something about it. And we also knew that you cannot be facetious enough to think that even though you're the second largest healthcare brand of the country, this is something that we'll be able to do all by ourselves. No, we had no such hubris to dwell into. So what Fortis did is put together a platform where other private healthcare providers could come, but also spoke to AIMS, spoke to NOTO, SOTO, ROTO. NOTO is the National Organ Tissue Transplant Organization, SOTO is state, and ROTO is regional, etc. These are all government bodies, right? So there's a sort of a tripartite, engagement going on with other private providers, with the government and all the NGOs who are working in that space, right? So we put together this platform. And while there was some serious work happening in this area, which is the training the nurses and having the protocols and going to states and say, ratify to the, Organ Donation Act so that organs can be harvested in the state. Chennai or Tamil Nadu is a model state in India for that perspective. And you might have heard that a lot of people do go to Chennai and take up residence there to get a organ, right? So all of this was happening, but from a brand standpoint, from a communication standpoint, we had to tell people that this is a problem. Everyone can sign up to be an organ donor, age no bar. Anyone can be a pledge, to koi bhi kar sakta hai, right? It'll only come to the stage that if in the unfortunate event, whether you are an eligible donor or not, right? But at least everyone should pledge. They should carry this card with them, which says that I'm a proud organ donor. Okay, so in the unfortunate event that it happens, God forbid, then the police, the first responders, the ambulance, the hospital, and your family, everyone knows that, you've signed up for this noble cause. Other lives can be saved. So in marketing, we said that no one thing will cut it. And therefore, we did a special project with NDTV at that point in time, and the NDTV Fortis More to Give initiative. And I think beautifully termed More to Give, because the idea was that no matter who you are, everyone has more to give, right? So in the first year, we did have army veterans, war veterans who had lost a limb coming forward and saying, I have done this for my country, but I still have more to give. I lost, let's say, an arm in a war, but I still have more to give, and I've pledged my organs, right? The second year, we had organ donors, organ recipients who were on wait list, them talking to others and saying that, I'm on a wait list for a liver. I'm signing up to donate my kidneys. That's like a jab in the gut, which makes us healthy individuals feel, what's wrong with us? Why aren't we doing it? If they can do it, why can't we? And in the third year, we had sports persons do that. Whether it was skits, whether it was nukkar natak, whether it was getting, celebrities to speak about it, influencers, walkathons that we did on Organ Donor Day, across simultaneous walkathons, walking the streets of India, raising awareness. You name it, and we did that for 3 years. And I would not say that it was only us. It was an effort that was being done by a lot of other, like all the people that I mentioned in the ecosystem. But right. With that combined effort in 2018, 19, and post that in 2020, with COVID, the priorities for everyone changed. But in 2018, 19, we crossed the 1 donor per million mark.
Wow.
Wow. So when you see that, or you have a campaign, and in 2 months you get a call from somebody who was the face of the campaign saying, listen, we put this out on TV, and now my father has got a liver or a kidney. I think there's nothing more goosebumpish than that. There's nothing more gratifying than that. So for me, absolutely. This stops it all, that we were able to create a little ripple in the system, give a platform where everyone's efforts sort of compounded, and the sum of the part is much bigger than the individual parts put together.
True, very true. I mean, this was something which made a lot of news, and I mean, thanks for sharing that because people want to know, what is the kind of impact that it has made. Thanks for that insight, Jasrita, because this was obviously a big initiative, and it ran for a couple of years, and there were so many stakeholders who actually joined hands because this is something which is which looks simple, but it is actually a complex address, complex problem to address, so to say.
Yes,
So
yes.
thanks for sharing your insights on this.
Thank you, Mehul.
Coming to our last question, any takeaways that you would like to share for budding professionals before we sign off?
I would say one, because that's guided me always. Um, be the voice of the consumer on the table. First of all, fight for marketing to have a seat at the table, because there are many tables that don't offer a seat to marketing. That's also true, right? Sales has a seat on the table, and finance has a seat on the table, but oftentimes marketing has to rest its way. So I think, first of all, fight your way for that seat on the table. But once you have the seat on the table, always remember that you are the consumer's voice, right? Like finance, they have to ensure the financial health of the company. The task is very cut out. For human relations, it is the internal stakeholders for employee. Always remember, we are not there to make campaigns which please the powers that be, right? It's very easy to become that indolent, lazy marketer. Very easy, very convenient, reap some revenue itself. But the one who's paying for the services is nobody on that table. We have to remember that the CFO, the CEO, the CEO, nobody's paying for the services. Who's paying for the services and therefore paying for each one of our salaries and the bills is the consumer, is the customer. And since the customer doesn't have a seat on the table, marketer is the voice of the customer. So always, even if it is unpopular, even if it's a little not political, I mean, not the best thing politically correct to say, but always say what you hear from your research, what you hear from the street, and what your customer is telling you.
And rightly so, because you started with, yes, marketing has to have a place on the table in the first place. And, in many industries, this is still something which is, building up now, fortunately. And obviously, what marketing stands for is something which you very nicely put, of course, the consumer, because at the end of the day, he pays for everyone's salary and keeps
Or
the
she.
company, yeah, he or she, absolutely. Pays for everyone's salary and keeps the things going. So yeah, absolutely on point, I would say. So thanks a lot, Jasrita, for all these insights. Anything else you would like to share?
Thank you, Mehul, for having me. This is a wonderful podcast that you do, and quite a lineup that you've had. So more power to you. And thank you very much for having me here. I really enjoyed my time talking to you.
Wonderful. So nice of you. Thanks. So, ladies and gentlemen, we come to the end of yet another exciting podcast on the Growth Genius platform. And this podcast is slightly more, I would say, interesting because we normally don't get many healthcare marketers on the podcast. And Jasrita addressed a few very important points in this podcast where she spoke about how healthcare per se is though for profit but not for profiteering. That is something which is very insightful, and also she talked about her passion and one of the best projects that she has handled, that was on organ donation, which actually helped to move the needle on organ donation across the nation. So I would not talk much about the podcast here. I would like you to go through the entire podcast. And as you know, all our podcasts are available on all the platforms, be it video or audio. The links of these platforms are mentioned in the descriptor below. So enjoy the podcast and keep learning and keep inspiring. Thank you.